we want to dive deep into the questions that's been echoing in our community. Where's the money going? Specifically, the U.S. funding meant for LBJ Hospital. LBJ, it's the lifeline of our healthcare in American Samoa. But why do we still hear complaints? That's what we're talking about outdated equipment, long wait times, staff shortages, when millions are supposed to flow into it. So that's why we're talking about it.
Why Uce and Queen, we're family strong. Two cousins in America where we belong. Join the journey, let's pass the time. With culture, dreams, and hearts that climb. From American Samoa shore to America, we're so much more.
We're going to update you guys on what's going on with the Uce Podcast. Right now, we just updated our website. That's been about 24 hours now. So if you get the chance, go ahead and tune in or log into our www.yuce.com. We are now officially affiliated.
Hey!
Yes. What does that mean to the coconuts? Affiliate marketing is basically we get a small portion of commission from it. What does that mean? It's basically like the softwares that we're using. It can be anything of merchandise or stuff like that. But for us, we have 3 affiliated products, which is through Riverside. That's what we're recording on right now. This is this great software that we just got. So shout out to Riverside. Also, we have CapCut. All our short clips that you see on all our social media, all this whole thing right here, this whole podcast, hour and a half, however long it goes, you upload your file into that and it's going to spit up 20 plus short clip videos for you to be able to craft and just post it up. So that's the cool thing about Opus Clip. The third one we have is when you edit, because you have a different software where you have to edit all your episodes. And that is where we have CapCut. Did I say CapCut first or did I say Opus?
You said CapCut. That's okay. You said CapCut, but now you talk about Opus.
Yeah. So it all goes hand in hand, guys.
Right.
Riverside is what we use to download this. Then I put it into CapCut, which does all the editing. And then to put it out to the listeners who are now tuning in and how y'all found us, is through Opus Clip. There you go, guys. So, man, if you guys are inspired by this, you don't even have to be a podcaster. You can even just be a content creator or whatever you want to do, fancy editing, stuff like that. Check out those softwares or applications, whatever you call it, man, because it will definitely help us. And why do we need that help? Because it helps bring out these episodes for you guys. You know what I'm saying? There you go. What you got for us, Queen?
We're going to stay true to our words and uplifting and promoting our local businesses. So today, on today's podcast, we want to give a shout out to our girl, Toker Establishments from the Uce Podcast crew. All right. You can go to our website, www.tokerest.com. All right. So level up your style and self-care game with Toker Established 2024. Go-to for hoodies, skincare, hair care, and beauty products made with care and responsibility. Proudly made in America, globally inspired, and always cruelty-free. Toker S, shout out to you, my girl. Have a good one. So let's talk about the LBJ's role. It's the main and sometimes the only place many of our people can go to for life-saving care. From dialysis to childbirth, from emergencies, ongoing health challenges like diabetes and heart disease. Now, we know that's huge back home. Not only back home, but here too as we speak. LBJ is our central for community's health. Yet the stories we hear don't always match the funding numbers. So where's the disconnect? Where is the disconnect? That's the question that everyone's asking for. What I presented to all of us earlier in our previous podcast is we got to go look. Sometimes the answers are right there. Like I went to www.americansamoa.gov. They actually have the financial reports on there, and you can look at how much money came in So if you have time and you really want to do your research and answer some of your questions, because we have to do our due diligence too, to look into how much money's coming in, how much is going out. Let's break down the money trail. LBJ receives funding from multiple U.S. resources, right? Sources. Medicaid and Medicare alone provide millions. Medicaid contributed $16 million just a few years back. And to that, the grants from the Department of the Interior, DOI, and private organizations, which just gave over $3 million for new medical equipment. But despite this, hospital still faces challenges like outdated facilities and overworked staff. We are missing something. The money are allocated to us, just like, you know, how everything else in the Department of Education and the infrastructure, but we're focused on LBJ today. Where the question from the community is, what did we do with the money? Did we actually do what we say we were going to do with the money? I know that we have extensions like the Tafuna Medical Center. It's not too big, but it's right there in Tafuna. And then you have clinics. Like I know there's one in Leone. I'm not sure about the east side of the island. But just questions like that, because there is specific money to fund those places and fund equipment and wings of the hospital and so forth. So the key point is looking up the federal funding. Where did it come from, and did we actually put it in place? Did we spend the money where we're supposed to spend the money?
So I know that, speaking of that, the one in Falaima, they spent they sent or put aside 20 million around that number. I'm not sure exactly what the number is, but it's the one in Kafuna that they got for a small clinic, right?
Yes.
That's part of the LBJ, which makes sense because of the distance and stuff like that. What else did you find? Like, is there like a specific one as far as the use of the money that you have a question on?
I just want to know, did they upgrade? Did they update that facility? I don't live there, so I'm asking our people, do you know if they updated the machines out there? Did they fix like air conditions, waiting areas? Has it been upgraded?
Because one of the main concerns, like when me and Queen was living there, was the fact that, remember that stigma? I don't know if it's a stigma or they just always say like, man, LBJ, once you go in, you never come back. You know what I mean? Because of the fact that, we witnessed that, man. I remember a few of our family members, the older ones, like aunties and uncles, who went in and never came back out. They went in for just a regular checkup and I'm not blaming LBJ. I know that we are limited to resources, and I know, but we're not trying to just bash on LBJ. We know the fact that we're just limited on resources makes it a lot more complicated. So first off, I just want to be transparent. Shout out to LBJ department, from the staff all the way down to the nurses and all, just the working people. You know what I'm saying? Because without you guys, we have to be grateful, first of all. Right? We have to be grateful that we have a clinic there or we have a hospital there. The only thing is, when we're funding you guys, when the government is giving out this money, our tax-paying money to our community, and our people are not seeing changes in the facilities, right? It makes people question, right? So is the money going to, like, I can understand if they'll be like, okay, here's the report. A lot of this money went to Dr. ABC, because we need these professional doctors to come in, whether it's diabetes, whether it's just a cancer, or just any kind of sickness that our people are so accustomed to. I understand that we got to pay them money. You know what I'm saying? Even the fact that, would it be also like, now I'm not sure on top of my head if everyone that are American Samoa residents can get a ticket, because I know there's a fund just for the Hawaiian airline to take you straight to, the bigger facility for help. So I know there's funding on that part, but does that help everybody in the community? You know what I'm saying? Just questions like that. Anyways, what were you going to jump into?
No, I was going to add on our own personal experience when living on island. I did hear all of that. That was like, going to ASCC. That's all we hear. Oh, so you walk in there and then you come out from the morgue. People go in and they get wrong medication. They've been wrongly diagnosed. And that was the stuff that we've been hearing growing up, living in Samoa. And I remember this is traumatizing, but I didn't realize it was traumatizing when, we took grandma to the hospital, and it was me, your mom, and an auntie. And all of a sudden I saw grandma like go into a cardiac arrest. At the time I didn't know what it was. And I just saw her body go up. And then when you hear the professionals looking for something, I forgot what they were looking for, but they were just like opening all these drawers when they brought the cart in, and like asking in Samoan, where is this this thing, bro? I just like turned around. I'm like, my goodness, we're about to lose grandma, and I just started bawling. And then me, your mom, and we just faced outside. I didn't even want to look. We didn't even want to look at it anymore, But to me, at the time, I did blame, the workers there, because I was so upset of how it was handled. Because I first, then as time went by, it's like, that's why I like to speak on this, because it's the resources and the training that we so badly need back home. We need to pay attention to where this money's going, because we are getting the funds, and we have to have good leaders in place to make sure that these funds are allocated to where they belong, and, not just half-ass things. I'm going to check this box because we already did it, so let's just move on to the next. No, let's use the money and get quality equipment, quality programs, quality staff, and just upgrade our places that it needs to be. I mean, if you have to take it one day at a time, then damn, do it. But being there and seeing the hospital, the condition it is, to me, it's still the same. Maybe they've upgraded stuff inside, but from the outside, the exterior of the building is still bad, So yes, we're not here to bash LBJ. We're just here to put out what we found, the funds, what's coming in, and how it should be spent, or has it been spent. And, I know we're the voices of a lot, because a lot of people don't know where to go. Sometimes, they're speaking amongst each other. You had Samoa News, but it's like, some people don't know where else to go. But now they got to social media. We're able to have these platforms, not only just Uce, but other platforms to speak on this. But Uce, we want to focus on problems and issues and ways how to fix them. And so that's why 2025 is huge for us, because we know that there's a new administration. So we're going to see what they're about to. But this is the history that we know from our experience of why we like to cover these topics, because it's very vital. And like I said in the past, eventually I'm going to want to move back home, and I want to ensure being part of the solution and not part of the problem where we just complain and talk about it. So that's why I'm very grateful and thankful for this time.
It's important for our community to understand that we can't just be asking always like, where's the money going to? We also got to understand that the benefit that American Samoa has, we don't have that benefit out here in America. We're talking about Medicaid. What's the other health benefits that American Samoa's government is able to have, right? So, prime example, man, I believe that if a pregnant woman was to go you're in American Samoa, I think the only copay out of pocket is like $100 or so, or even that. I don't know, around that numbers compared to the U.S. for us tax-paying people. It's a lot more than that. So, weighing the the outcome, we get that part, because I know that a lot of people, it's just for the sake of transparency. We understand, hey, you can't just be saying like, where's the money and how is it being spent? We're taking all that in consideration. You know what I'm saying? It's just the fact that it's a voice. It's been a common thing that we always hear. Man, the government is doing this. And we hear it here in the U.S. too. You know what I'm saying? Until you're in that seat, in that kind of position, you will never understand the levels of why things are getting spent. But we just want to be that voice to bring it to light, because I say this again, Ili, it sucks to go try to do some research through internet, because I love looking through YouTube, Googling it, finding some resources, and it's very limited. A lot of the stuff is just 3 years, 5 years ago. You know what I'm saying? So
yeah.
That's why we're doing this, y'all. Is to shine the light on it. And just a call to action for those that knows this, and if you're the one to be like, man, these two don't know what the fuck they're talking about, we invite you to come on the platform to help us educate that, because we have a platform
Absolutely.
to share this. You know what I mean?
Mm-hmm. Absolutely. So please come on. And if we don't know what we're talking about, then come educate us. We're all about learning what's going on. And Moafanua, you're right. There's hardly information out there because there's no data. There's nothing keeping track. There's never, I don't say never, but it seems like it appears that there's no transparency of the reporting of what's going on back home of the funds and stuff. You mentioned earlier about when you go to a doctor's appointment, the copay is very low. Why? Because it should be affordable back home. And that means when the money you get from the grants to apply what's going in the hospitals, it's supposed to be quality stuff. You know, it doesn't mean because we have a low copay, we have to be treated like second-class citizens. And that's one of the complaints back home is how patients are being treated. Not only when you're talking about pregnant women, when they're giving birth, you have nurses, talking crap. I hear the stories all the time. And then you have patients being rude. Staff being rude to patients who come in. Just because we only pay, a $2? I remember back then it was a $2 to get your tooth pulled. It's probably a little bit more. And doesn't mean because we pay so much little, people have to be treated that way. And go back to it, a lot of money's going elsewhere. So people just want to know, where's our money going? And like we said, is let's be part of the solution, not just continue to complain. My question would be to you is, have you ever went to your representative and asked them about where's the, what's going on with our hospitals, whatever that's important to you? Do they have meetings? I know like they have town hall meetings here where Congress or Senate, mainly congressional staff, have town hall meetings where you can go there and ask questions. I'm not sure that happens in Samoa. Or have you even written them a letter? So what have you done to try and, resolve this, back home, instead of us just, like I was one of it. All I did was bitch about it, but you need to be about it. And I know through my career, what I'm doing here in America, United States, is I'm all about it. I know there's problems going on here, but then I'm part of the solution. So that's why I'm doing this for our island back home, because I know eventually I do want to come back home. So I want to be part of the solution instead of part of the problem.
Disclaimer. There are footages that I added to it because it's from the Fongo from American Samoa. The senators from American Samoa, it is their channel. So they own every right to it. Also, just a few of the LBJ promotion to call to action for the nurses and sorts. Every video, little stuff that we put on our stuff, disclaimer is that we don't own any rights of it. It's just for entertainment and learning purposes only. $4.5 million. What happened to it? The whole thing screams poor oversights and bullshit. And like our people from the 684 always says, where's the money going? Million. Getting misdirected from the LBJ Tropical Medical Center. This isn't just about money. It's about leadership, accountability, and how this affects every single person relying on the healthcare back home. This crazy bombshell was dropped during a Senate hearing uploaded by the American Samoa Fongo Senate officials' YouTube channel. The major players at the center of this story, Dr. Malo Tuyolosenga, he's the LBJ's board chairman, Dr. Akapusi Leedua, LBJ CEO, and Mr. Sefanaya Kaumaitotoya, the CFO. We're going to unpack their testimonies, the Senate's questions, and what this means for our people. The Senate hearing revealed something of $4.5 million meant for the LBJ that never ever made it to their bank account. Instead, it ended up in Wells Fargo account. Why does this matter, Uce? LBJ doesn't even have a Wells Fargo account. What? So how did it happen? Well, according to the CFO, there might have been a phishing email involved. The fuck? A phishing fucking email. Are you telling me we had a Monty tail?
No way!
In the fucking health industry? Come on, man. But that explanation wasn't even cutting it for the Senate. They all grilled the leadership, asking them questions, important questions, like who signed off on this transfer? And what's up with the weird formatting on the official form, like British style dates and foreign phone numbers?
Come on now, dawg. Come on, man.
It goes on. The senator didn't hold back, man. And honestly, I respect that. They wanted answers, not excuses. And here's what stood out. The CFO admitted the forms used for this transfer might have been faked.
It's fake.
No, you're right.
Yeah, but no one at the LBJ authorized them to.
Are you serious to me right now?
He also went further to confirm that the money was never in the LBJ's account. It was redirected straight to the American Samoa government treasury to Wells Fargo, allegedly. And get this, the Senate even questioned why LBJ has off-island accounts with banks like First Hawaiian and Zion. They wanted to know if these accounts are even necessary or just adding to the confusion. I mean, the whole thing screams poor oversights and bullshit. It's like the perfect storm. Let's pump the brake. This isn't just about a missing of $4.5 million. This is about trust or lack of it. LBJ is the main hospital in American Samoa. If they can't get their finances in order, what does that mean for the patients, for the staff, for the future of healthcare in American Samoa? When leaders drop the ball, it's the people who pay the price. This is why accountability isn't optional, it's mandatory. So where's the evidence? Where is it leading? Lordigams, this isn't just a story to shake up our heads or shake our heads or be like, so this is fucked up. It's a wake-up call. If you care about the future, healthcare of our people, I urge you to stay informed, watch the full hearing. It's out there for the public to see. What do you think about all this bullshit? Hit me up on social media, drop a comment, and share your story. We can fight a call about this shit, or we can make sure our voice are heard and our leaders stay accountable. And that's what I got for y'all for today's series. So let's talk about it, right? Where is that $4.5 million and where did it go? You know, it's about accountability, right? What you think?
It is about accountability. I mean, how the hell are you going to come up there and say you don't know where the money... I'm just dumbfounded by the answers, quite honestly. So I'm just taking this in. The fact that we have a Wells Fargo, that it went to Wells Fargo, the Hawaiian, we have account with the Hawaiian bank and the other bank that you mentioned in the video. Why are we not banking that home is everyone's going to be asking. Now, these are the great questions that the Fono asked, and I'm glad they're asking those questions. That was earlier this year in February, with the dates that I saw. So, and you have those three guys just sitting there and they really come prepared to answer the questions, what it looked like. Now, this is just me coming out of the short clips that you put together. Me personally, how can you not know that you allowed money to go to Wells Fargo? That's a lot of money. Just the specific, right? The $4.5 million you're talking about went to Wells Fargo? Like,
Allegedly,
dude,
yeah.
Allegedly. You should know what is... I mean, you get training about type of scam of the emails that comes through, and why would you even click on the outside entity when we have banks on island to do this?
Even high school kids are aware, my kids are aware of what phishing is, you know?
Yeah. That's a lot of money. I'm just dumbfounded right now.
It's a lot to impact. And of course, just to grasp the whole story, obviously that's not the whole main point of the Senate's, the phono for the YouTube. We'll post all that below the link like I mentioned in the video, because it's important to understand what's going on. And through the whole video, they're talking in Samoan. So for those that are the non-speaking Samoans, you know, this is why we created this video, just to give you a little bit of understanding of what's going on. And we're not trying to bash anybody, man. We're just trying to provide our listeners with what we found out, you know, and if we can get more, We're not even freaking news reporting cast people. You know what I'm saying? This is just a dude. I don't even have a fucking degree, yo. Just information that I was able to gather from this stuff. You know what I'm saying? I could not have all my resources right, but that's besides the point. It's not about trying to blame them and stuff like that. Just the point is accountability. You're put into a position to help our island. And when you don't have answers for that, that's where the red flag comes in. So if you're offended for those that are staffed over there, then obviously the truth hurt. You know. But that's where I'm at with that, cousins. Go ahead.
Leaders are held at a higher standard. Once you take those positions, you know you're going to be you're going to be the representative for whatever entity you're over. You're going to be the ones that they come for questions. They're going to be basically coming after you. So if you hold a high title and you're in charge of all this, be ready to answer. But to go into the phone like that, like you said, like I said earlier, I didn't see the whole thing. Maybe they did have all the answers, but the answer that was provided in the short clip, if that was your only answer, shame on you. We need transparency, accountability for what's going on with the money, because money, it's all about following the money. If this is the way that the business has been ran, specifically for LBJ, if this is how it's been done in the past, no one was ever under this type of scrutiny in the past, probably. We don't know. But now everything is coming to light. The public is coming. Thank God for social media these days, because back then we didn't have, social media to be able to spread the word like this. So now, because of social media, the magnitude of it is out there. People are learning about what's going on with our funds back home, and what people are, especially the ones that are living out here, they're looking at it as, we pay taxes. This is our tax money that goes to federal grants that funds the government, is why there's a lot of questioning, because people feel like, since I'm paying my taxes here, federal taxes, I want to know where my money's going. So again, we're not here to bash. We're just here to bring information forward, and you can do whatever you want as you please. But if you want to come on here to Uce and talk about it, if you work at LBJ, if you are one of the leaders, we invite you to come and talk to us so we can hear your side. There's two sides to every story. Right now, we're just getting what we are seeing that's being portrayed at the fono. Yes, they bombarded you with all the questions. They probably didn't give you questions before coming out there, but we would like to hear your side. What did you do, so we can have a clear picture? It's all about transparency. And the more people know, the more information you put out there, the less the people, they'll put their faith back into. Right now, people have lost faith I'm just going to speak on my behalf. You slowly lose faith in what's happening, but you got to gain the trust back. And how to gain trust back, for me, is just to answer some questions. And if you mess up, you mess up. We can always go back and fix it. Whatever's happened has happened. But we need more transparency of the incoming money now, and what we can do better. We can't be doing the same thing over and over for the past decade, 2 decades, because that's what I feel personally that's been going on. It's the same routine, different year. Same routine, different year. Nothing has changed. So basically, it's not a new year. It's just another year with the same problems and issues. So in order for me personally to make that a brand new year and to make the changes, we got to make these small changes.
And for everyone, American Samoan that are out here in the U.S., it does matter to us. You know why? Because that's our tax-paying money. The grants that our country is getting, our island is getting, is from our hard-earned money. So that's why we're passionate about it. So it does matter. Our voice does matter. So let's get on to the next one. What about the British formatting that they had? That one right there caught my eyes because the email and Comiola's the one that pointed that out. Makes me wonder, like, hold on. So are you telling me that the format that they had with this email, so-called email phishing, the formatting was all in the UK kind of style, not even an American document? That should have, I get it. You're hiring younger generations. I can see that the young bro, the Uce that was over there, the treasurer, whatever he is, just really sucks, bro. You know what I'm saying? It really sucks. And then I also want to apologize to Monty Teo, because it's I'm not trying to bash you, bro. That's just the first thing that came to my mind. So the creativity that you see in the video is everything that pops out in my mind. And that's what happens. That's who I come to think about. So again, it falls down to accountability, knowing what you stand for. You know what I'm saying? That's what that is.
Can you, what did Toniola ask about those? What was his question?
It was, as it went on, the question was simple. He's like, well, let's just, because the CEO obviously is not a Samoan, that's a different topic.
Okay.
Just from the video, you can just tell because the CEO is not the ethnicity, wouldn't have an impact. And before I answer that question, I want to go back to the Uce that was in the middle. I believe he was the chairman. My heart went out to him because you can just see at the end, he's getting bashed at. And he's trying his best to, because he knows that he hurts for our people,
Right.
And he's getting all that blame. So shout out to the Uce. Because it's, again, this is not an intention to bash on you guys alone. It's just trying to provide information. But Toniola was asking about, okay, let's just, since you can't provide the data from us, this is from the CEO, because the CEO was not providing information of what the email entailed, because they have the right as senators to ask those questions.
Okay.
Then Toniola went ahead and said, okay, well, since you can't provide, then let's just talk like regular folks. Even the email itself, the format I notice is in British. It's in a Upolu kind of style. You see that kind of styles. Yada, yada, yada. And that was a red flag to the former governor. You know what I'm saying?
Yeah.
To me, I'm just like,
okay.
Kudos to you, Toniola, for even pointing stuff out like that. Since they can't provide information, we'll go ahead and answer the stuff that we do have right here.
Okay.
And that's
that makes sense.
that's where that
Okay.
whole thing came on.
All right. I just wanted a better understanding of that. Okay. So I know what the intent of the question was. Makes sense.
Yep. And again, this is for all the Moafanua people like me, which I know there's a lot of us, who is very lazy to watch and sit through a whole hour of video, because it is about an hour and change to sit through that. But I know I'm getting old, so I know I'm like more in tune to it. And I only did it for the purposes of our listeners, because this is what you guys wanted. We're bringing it out to you guys. You know what I'm saying? That was the effort and the passion that me and Ili have to even take the time out of our own personal time to care about the zoos. You know what I mean? But after doing my research, my heart goes out to y'all, because you guys are the one that made me who I am right now. A part of it. You know what I'm saying? So that's where I'm at with that, cuz.
Okay.
Yep. And then the community responds. You know what I'm saying? You've seen this. If you watch the video, all the senators, they were just outrageous. They were just
outraged. Yep.
Outraged, just in disappointment, and it's just, and you have every right to. You know what I'm saying? Because they're asking all these questions and there's just no information. And you just it's just a slippery throw. You know what I mean? But so what's the lessons that we can learn for this, cousin?
Make the changes, the necessary changes for the accountability. Listen to the community, and the community also to get involved instead of just continue to point fingers. We have a new slate. It's January 2025. Make this a great starting point, and we just have to do better by participating and getting more active and helping our new leaders, our leaders who are going to take over, or maybe we'll have the same leaders at LBJ. Just learn from your mistakes, because we all fail. We all fail. But the only way we're going to learn is when we do fail, we get up and we just dust our knees off, dust our shoulders, and learn from that and not continue to do the same mistakes over and over. It's basically changing what you did wrong so we can move forward and do better. And just be transparent with your team, the community, just doing right, doing better, and learning from your mistakes. So basically, we all just need to fail forward.
I want to ask the listeners, how do you think that the 4.5 million situation affects the future of American Samoa, specifically the healthcare side? Number two, what would you say to the LBJ leadership or the Senate if you had a chance to speak up? And that's nothing new, right, guys? Anybody in whatever island that you're from, you feel the same pain when it comes to your government or your sovereignty. And that's why we start off with American Samoa, but we invite and encourage our Guamanian families, our Fijians, Tongan, Hawaiians. Reach out to us through Uce.com, and we want to go ahead and share these stories. Like Queen mentioned, also known as Ili, we are not experts, but we feel like we are a voice for the Polynesians to spread the word out here in the U.S. You know what I'm saying? So especially shout out to Finau.
Oh, Finau.
Yeah, man. Shout out to Finau for inspiring us, the Uce Podcast, to go ahead and talk about this.
Today we're going to introduce a new segment, Motivation from your girl, Ili. It's vital to give out motivations on a daily basis because I am a true believer of it. Everyday affirmation is very important, is to always start off your day with something positive or something also that could be perceived as negative, but you turn it around and make it a positive to get your day started. It's all about what you put in your mind. So it's like a computer, you put in the data into your head, and this is your daily motivation from the Uce Podcast from yours truly, Ili. So today's motivation is give yourself permission to focus on yourself right now. Take time for self-care, self-love, and self-compassion. Make it about you today. Go out there and take care of yourself before you try and take care of others. That's the motivation from your girl Ili, Uce.
Thanks for tuning in to the Uce Podcast episode. Don't forget to check out our website at www.yuce.com. It's because of you that we can keep this going. Thank you in advance. See you on the next one. I'm Moafanua.
I'm Ili.
We out.
We're family
See ya.
strong. Two cousins in America where we belong. Join the journey.